Hey there, everyone. Welcome to Between Us, Navigating Lipedema Together. I'm Lisa Duerre, and I'm here with Dr. Catherine Seo, and we are so glad you're here. Whether you're here live, we'd love for you to chat and let us know where you're coming from. If you're watching the replay on any social media channel, please comment, like, and share. We want to spread the word. And we are going to be in conversation about all things heart to heart, our 3-day event that just wrapped up because there was so much insight there. We want to make sure that if you weren't there, you can learn with us. And if you were there, you can share some highlights too. Catherine, we're here.
We are here.
We are here after 3 days of an
What
amazing event, early
an
in the morning, ready to rock and go live, right?
amazing weekend. Amazing weekend. I'll tell you. So I want to start out with my next actions. So one of the things that we invited people to do was just to take and write down what was their very next action. What were they going to do that would make their life better, different, help with their lipedema on Monday, today, being today, after yesterday. And I thought to myself, well, what should I do? And it just
Mhm.
emerged. So I want to say, people everybody knows I've been very sick with central lymphatic issues, had surgeries. Well, my mobility has suffered from it. And I came back from Pennsylvania after the second surgery, and I tried to go to the pool, which is helpful because that's how I get my physical therapy in. The problem is that the pool, getting to the pool is fine. It's getting from the parking lot. There's a fairly long walk from the parking lot to the health club. And then in the health club, the pool is on the other side of the health club. It is like, for me, really challenging. So I stopped going. Now, that
Mhm.
doesn't make any sense because I've had a number of people say to me, what do you need to do? And I need the pool in order to strengthen enough to walk, but I couldn't walk there. Anyway, I called this morning and asked for accommodations, and they gave them to me.
Hold on, hold on. You literally just asked for what you needed and they said yes.
Yeah.
Congratulations, Catherine. That is sometimes it takes a lot for us to even go, "Oh, I could ask for help," right? We're so busy trying not to burden people or ask for anything or I'm so inspired by you. I have something that I just wanna yeah, I'm not trying to hijack your story. I'm just that's very exciting. Yeah,
No.
people are already going, "Oh my gosh, amazing, perfect." That's so cool. Yeah.
Well, that's what I realized this weekend. I have such a hard time asking anyone for help.
Mhm.
And what am I going to say? It just, so then I was like, okay. And then the way that I did that, I actually, someone from the conference and I spoke. She was an attendee and she's a dear friend of mine. And we said to each other, okay, how can we support each other?
Mhm.
So she was the one who encouraged me to call. They arranged for me to park at the back door. As soon as I get there, I have to call someone because they have to come because the back door is locked. So I have to be there for 5 to 7 minutes to wait for someone. And that's fine. I can do that. And they'll let me in and I won't have to do all the stuff. How simple is that? And how have I not been doing that um, since November?
Mhm.
So it's sort of like that. Anyway, that's it. That's my little story.
Wow, but no, I mean, it's a little story, but it's huge, and it was one of the themes of our conference, which is better together, right? We have accountability and support in these events. We have breakouts. We connect and hold each other safe, right? Our heart guides were in all those breakouts supporting everyone because they've got the lived experience of coming into our community and knowing you don't know what you're getting into till you're there, and then you're like, "Is this magic or what?" right? And because there's so much love and support. So the fact that you
Mhm.
were aware enough and had the reflection time with us and went, oh, there is something I need, and there's a way to get it, and look how easy that was. I think your story is super inspiring.
So we have a bunch of people on this morning. We have over 30, 37 at this point. Um, what did you do? Anybody put some of what did you do as the next action step in the chat? And let's see what other people are doing.
Yeah, let's check that out. Can I share my next action?
Yes, what's your next step?
Yeah. Okay, so this is never before talked about. So thank you for being here with me, and I'm about to get super vulnerable, okay?
I love when you do that.
Well, it's scary, right? But this is a safe place, and we're keeping it real. We're talking about what goes on. So, I run a consulting firm, RLD Group, right? Rebooting Leadership Drive. We were a sponsor of the event. And I've been working really hard to figure out how to show up in the world as someone who runs a consulting firm for burnout prevention and well-being at work and workplaces that work for all. And also being a lipedema advocate, a managing director at Lipedema Simplified, because I'm always like, am I going to dilute the message? Are people going to be confused as to what I do and who I am? But the reality is I do it all. Like that my whole person, I don't take my lipedema and put it away when I'm consulting with our clients at RLD Group. And I certainly don't take off my leadership development burnout prevention hat when I'm facilitating and running, events with you at Lipedema Simplified. So about 6 months ago, I have a private Facebook group for my family where I update on my health. And I have friends in there too. And it's very private. It's just when I first started, I didn't even know how to talk about this stuff. And I was like, how do I update everyone without asking me the same question 12 times, right?
Mm.
Sometimes 20 times. Anyway, in my private Facebook group, one of the people that helped me with our website is in there because she's a friend. And she reached out and she's like, we need to redo lisaduerre.com. Like you can be your whole person on you as a brand on your website because I had taken it down. So behind the scenes for the last 6 months, I've been putting pictures up and figuring out what my messaging is and trying to figure out how can I speak more inside organizations, explain what we do here, own the fact that I have this disease and I'm working through it, a working mom, all the things, Catherine. And I'm gonna go live this week with it. I'm gonna put it out there. I hadn't put it out. It's been live, but I didn't tell a soul. And I'm like, you know what? After yesterday and the day before and the day before being in community and talking about this, I think I can help more by being honest about all of me, not parts of me. So I'm gonna launch that this week, and the conference gave me permission to be fully me, not just pieces of me in different rooms.
Oh, how fabulous, Lisa. Gail, I put it in the private chat so you could put it.
Oh, look.
So you can.
Well, there that goes. Okay.
You can. There it is, lisaduerre.com.
Oh, wow. I haven't even written the email to announce it, but this is how we roll. We just thank you for supporting me and being accountable, Catherine. There we go. It's out there now, right?
Yeah, it's fabulous.
Well, I think the thing that really surprised me in this journey was how many of us, especially at work, which I was doing too, is like we bring parts of ourselves.
Mm-hmm.
We bring parts of ourselves. No, I'm not doing that anymore. I have lipedema. I am an expert in burnout prevention and leadership development. I do work at Lipedema Simplified. I do all that. And so that's where it's going, right? I'm the whole me. And so seeing everyone say, okay, I'm not alone anymore. I feel like I found my tribe. Oh my gosh, you guys get it. I needed to be in integrity with myself and own my story. And so some of the laser coaching inspired me. The people that were there, like Dabney and the others that Tamara, that brought their stories forward. I'm like, okay, I'm doing it. So you're going to the pool and I am going public.
That is so good. And here are a couple of others. Wait.
Yeah, let's see.
Facebook user decided to focus on self-care more and went for MLD today.
Yes.
And Christine, rededicated myself to carb manager and started tracking keto again.
Oh, Christine, congratulations. Oh, that feels so good. Yay.
here's someone. I just came back and feel so much better. Welcome back.
Welcome back.
Welcome back.
Yeah.
And Marilee, who's a longtime triber, she has her first MLD appointment today. That's amazing.
Oh, and the person that said they're welcoming, that we just welcome back is Agnieszka.
Oh,
Yay. Yay.
oh, Agnieszka. Oh, I'm so glad. I cannot tell you how happy I was to see you.
That's so awesome. Yay, Agnieszka.
Agnisha's had COVID and a really rough time with it, in addition to taking care of her twin boys and dog and one other kid. So she has three kids, but twin boys. And so we were missing you, Agnieszka.
That's so awesome. So, whether you went to the conference or not, here's the invitation. Who can you talk to about what's going on, where you're feeling stuck or overwhelmed, or you should do something for yourself, but you need to borrow someone else's confidence in you or have them be your cheerleader? Find that person. Find that person. And if it's right here, drop it in chat and we'll help you too. But don't do it alone. Don't do life alone. However, we can support you. However, we can support you.
Lisa McGuire, I think this is important. My next action step today was to start my vision board, which includes taking care of my health, my body, and what I want to be able to do. Mobility is a must for me. And I have never been so scared to push myself, but this weekend was the nudge for me. Oh my God. I am so here to support you. It is really a challenge, but we're in this together. That's really what Lisa said makes a difference.
Yeah. I mean, isn't it interesting that we titled this Between Us Navigating Lipedema Together? Because that is the magic. It's being together.
Hmm.
Yeah, I love that so much. Oh, I love thank you all for chatting. This is so helpful to just see what's going on and know where everybody's at. Thank you. Oh, excuse me. We're live and I'm coughing.
Oh,
Sorry
well,
about that.
yeah. we're
We're
always,
live and I'm coughing. Okay, so Catherine, you've
yeah,
done a lot of these events. We opened up Tribe. We've invited people to the 3 membership levels. We
yeah.
brought experts from around the world. And what I kept hearing from people was, oh my gosh, how do we get access like this anywhere else? And I'm getting DMs now and messages like, I went for the regular ticket price just to be there. Now it was so good. I want these recordings. And I honestly wasn't sure how to answer them. And I know there's a lot of people here that may want to know about that.
Hmm.
So if you were an attendee and you want the recording, oh, there we go. Okay. So email support@lipedema-simplified.org. They'll take care of you. Yep.
Yeah. The recordings will be eventually open to everyone, but you've already paid for live access. So you get the recordings if you were there this weekend or even if you were registered, um, obviously at a conference price. So
Mhm.
we want to make sure that you get that. So just email support at lipedema-simplified.org and say you want the recordings. And you do want these recordings. They were amazing. We had Leslin and Siobhan, who were our conference directors. They gave incredibly good talks, but the speakers that they brought in Carrie, who is one of our coaches. She gave a fantastic presentation on living your life with keto or low carb management, and how can you bring that into your life and do it in your world. And Peter Balestrat, he was really fabulous, talking about really agriculture, the world, and how we can, in making ourselves better, and the use of animal source products. It also helps the world, which was really good. And then Dr. Jen Unwin, amazing UK. She's from the UK. She's a PsyD, a doctor of psychology, and works with addiction, but specifically issues around food addiction. People are talking and this has always been part of the conversation because I've been in Overeaters Anonymous forever, since the 80s. Is, there's overweight, there's obesity, and there's food addiction, and they're not all the same thing. And she gave a very clear talk to understand the differences. I mean, there are people who overeat where it's not an addiction. They overeat, they're like, yeah, food is great, and I'm going to have some ice cream every night after I finish, sit down, and it causes a weight gain. We're not talking about that. For some of us, there are certain foods that trigger us. I was talking to Deborah, one of our tribers. We were just chatting. I think it could have been last night, but it could have been this morning. I can't remember. Anyway, cheese is that for me.
Mm.
Cheese is in my fridge. It's like the weirdest thing. It's like I keep until it's gone. I keep going back, a bite here, a bite, it's like, so there are certain trigger foods that we have. Anyway, she was amazing. Anyway, so Jen Unwin, and then Brian Wiley, who was talking about how do you do healthy eating on a budget. Wasn't that fabulous? There's so many trips.
Yeah, I was like, Randy, quick, you need to like this, because Randy does the grocery shopping in our house.
Yeah.
Right. And I was like, please come over here. Really. So he sat down next to me and he was like, this is also simple that we can do. And yet we don't think about it because we're busy. And
yeah,
it was wonderful.
Yeah. And then our keynote, I forgot on Monday we had Dr. Gabrielle Faber,
she was amazing.
Wasn't she good?
Yeah, she was very clear about why it matters and what it is about lymphatics and the German guidelines, which, one of the things I love is you have brought global experts into this community so that we don't have to fly to Germany to talk to Dr. Faber. We literally get to hear from her virtually. It is mind-blowing, the level of expertise that you bring into this community.
Yeah, it actually is. It's so cool.
It's so cool.
And Dr. Georgia Eid, can you share a little bit about her? She was incredible.
Oh, yeah. Well, I got her book right here. Change Your Diet, Change Your Mind, right? You guys there was a book club at Lipedema Simplified open to the public. We normally keep that for Tribe, but we knew she was coming. So here comes the book club, and I was trying to play catch up. And I don't even know how to explain the unlearning I did by listening to her, the unlearning I did from all of the different diets I've done and medically supervised weight loss programs, and understanding the tie between what we feed ourselves and how that impacts our brain and our mental health. And I kept thinking about today's generation with all of the processed foods that's where they've been raised on, where older generations have it a little bit differently, and we've navigated over time. And it was a wake-up call for my family, for sure. I was embarrassed a bit because when I was thanking her for presenting, I had tears in my eyes of gratitude. And I thought, well, I guess if you're giving a keynote and you move people to tears, it probably feels good. So I, stayed present in that. But run, don't walk. Like, hopefully you guys have this recording. What in the heck happened? Because she was so clear. It was so easily digestible, and I didn't have to sit around in shame thinking, well, boy, I really screwed my family up, or I've been doing this to myself, which is where we go. I felt hopeful because she kept saying, like, it doesn't take a long time to turn this around. Like, just do something, which goes back to you doing something about the pool. I was very inspired by all of the speakers. And you asked me about Georgia Eid, so that's my answer.
Yeah.
Yeah.
Lisa, I'm thinking maybe we'll just post her talk on YouTube and make it available to everyone. It was so phenomenal. And then people can get the whole conference. We can put a link up. But she was so phenomenal. I felt like she held the key to so many of the questions that we hear again and again and again.
Oh, are you saying like we'll put Georgia's up as a surprise and delight, which is what you always do, and then if they want the others, they can,
Yeah,
register for them. Yeah, that makes sense. I
yeah,
think that's a wonderful gift to the world, honestly.
yeah. I feel. I mean, everyone was so good, but if I were to choose one, I would definitely choose Georgia Eid. Yeah, let's do that. All right.
There we go.
And
As
then
Catherine always does. Here's a surprise and delight, indeed.
yeah, and then we had Dr. Carmody, which I got text this morning about it.
Mhm.
So Lisa brings so much to whatever we're doing, and she was like, "We need to have something on the new semaglutides, Ozempic, Wegovy, Mounjaro, Zepbound, especially after Oprah."
Yeah,
Oprah's special went viral about weight loss. and
the weight
the
loss drugs.
yeah, and the question is, do the semaglutides work with lipedema? And Dr. Carmody is our medical advisor, and he is, by training and background, an internist. So he's a primary care physician, but he's also a specialist in obesity medicine. So he came in and he did an amazing talk about what it is and what's good, what's bad, what do you need to know, what are the concerns. Wasn't he good?
I think Dr. Carmody is a blessing to this community that is sometimes under. I don't think we talk about it enough. Like to have an obesity doc who gets lipedema, who was your primary care and is our advisor. I don't know where else you get that. And so what I want to say about that is I could call you and say we need to do this, and all of a sudden you and Dr. Carmody are doing this. It's amazing. And the thing that I really appreciated about his talk was he wasn't even saying do it or don't do it. He was like, here's all the things to consider and bring to your doctor to have the conversation as peers about what's right for your unique body. And
Mhm.
he always goes there. He's never like, do this or don't. He's always giving you the things to think about. It's like a checklist. Here's the things to think about and factor in. And then you talk to your doctor. Excuse me. I'm getting a little choked up. And what I loved so much about that was then Siobhan Huggins, the research specialist extraordinaire Lipedema Project, who also supports Lipedema Simplified, and Dr. Leslyn Keith, the director of research at Lipedema Project, and so involved at Lipedema Simplified. They all got together and had what I believe if the world would have is a conversation about, have you thought about this? And what about that? And here's my perspective. And here's what I know. And mind blowing to watch the three of those brilliant minds coming at it through different viewpoints and helping the audience equip themselves to have a conversation if they want to.
Mhm.
It's mind blowing, Catherine.
Yeah. Lesson and Siobhan talk about nerding out. What
Mhm.
it is they are so focused and attuned to the underlying medical and clinical evidence. They never, ever do or say anything that's not grounded in that. And I
Mhm.
think that's, Lisa, when you started, you talked about, that we are, in some ways, we're different than a lot of other people talking about lipedema out there. And the real way that that's true is that we're grounded in the clinical, medical um, evidence, really.
Mhm.
In fact, I can't miss an opportunity to say our paper is getting published.
Oh, I know. I wanted to land that up for you. I was so excited to like, oh, Catherine,
Yeah.
Can I do something real quick about this paper? And I want you to pull it up, okay?
Yeah.
This is exactly why I feel like Lipedema Project and Lipedema Simplified represent the wisdom in the system and collaboration. So I want you to talk about the paper. You got to present this amazing thing that helps research, patients, caregivers, and anyone in between. Because what you have done with this collaboration is define something that has never been defined before. So there is your lead up. And now take it away, Dr. Catherine Seo. Talk about this paper.
My God, it was such a journey of love. We started a few years ago. Oh, thank you so much. That's Gail in the background making it easier to read. um, it, it's called the Proposed Framework for Research Case Definitions of Lipedema. No one defined it. Nobody had defined lipedema. And because the research was so splotchy, and there's been research, but in order to have what's considered to be rigorous, grounded research, you need to have a definition. No one had done it. So we started a few years ago and we worked on it. There were 10 of us. So the authors, Dr. Leslyn Keith, myself, Monica Wahi, who is here in the Boston area. She is an epidemiologist and has a specialty in public health. She's amazing. She's worked with us for years now. Siobhan Huggins, Dr. Matthew Carmody, and then we had some Europeans with us because really a lot of the specialists are in Europe. So Dr. Gabrielle Faber, who came and was one of our speakers, Dr. Isabel Forner Cadero from Spain, Dr. Faber's from Germany, Dr. Forner Cadero is from Spain. She is one of the top not only clinicians, but also researchers in lipedema and in other lymphatic disorders. She's just brilliant. Um, Dr. Sandro Michelini from Italy. He is a physician there, but he's also been very instrumental in the lymphatic societies. He was the president and lead in the European lymphatic lymphology. I think it's called Lymphology Society. But he also founded the Lipedema World Alliance, which hosted the Congress in Potsdam, Germany, in October.
Yep.
And of course, Dr. Stanley Roxon. So Dr. Roxon is amazing. He has taken the lead in the initiative to get lymphatic diseases recognized and funded for research. He's now the chair of the Commission on Lymphatic Diseases at the National Institutes of Health, which is the epicenter here in the US for research. I'm hearing myself say these words and I can hardly believe it.
Yeah, it is phenomenal. And when I tell people, one of the things is everyone should download this right now. We also have a press release about it. Please share it with your clinician. Stick it in your medical records if you need to. Share it with a loved one. Bring it to your CLT. Oh, there's Crystal with 3 hearts. Yeah, Crystal, we got to do this, right? So bring this paper. Crystal was on last week with us. She's an amazing advocate out of Canada. Thanks for being here, Crystal. This paper is amazing. And if you need a diagnosis, it's really hard to get a diagnosis. But now there's a chart in there. You can do kind of what I did with my primary care. You go, hey, here's all the things they say lipedema is. I think I have all these, right? And here's what I think is next. I've guided my primary care because she didn't know about it. It is so powerful. And having been in Potsdam, Catherine, and hearing all the updates on research and knowing that the sample sizes were 12 patients, 22 patients, if it affects 1 in 11 women, we need much bigger sample sizes focused on this to make traction. And what you've just done is give everyone, researchers, clinicians, patients, caregivers, hope. Like this paper. I'll get off my soapbox. But as a patient and an advocate and someone who has been to Potsdam and heard all the research, this is going to change the game. And I'm so excited. So there we go.
Yeah, Dr. Nelson asks about CME for lipedema. It's very sparse. Email support at lipedema-simplified.org. Gail will put up the email address. There is some information, but as I say, very, very sparse. But I will email you what I know.
That's awesome. Thank you for being here, Dr. Nelson, to hear what's going on and be a part of the conversation. There is a doctor in here wanting to learn more. If I could throw a big heart right now, that's a big deal. So, Catherine, one thing I want to say as we wrap up today, you're all about surprise and delight. And this is our 6th episode of a 6-week series. And we're done, right? This is it. We're going to just put this into production, share it with the world. We've gotten through the conference. We've connected with the community. We've shared our stories, hopefully inspired people. And, this is not an easy thing on Monday mornings. There's a lot going on in the world. So what are your final thoughts?
So I'm curious, for those of you who are listening, let me know in the chat if this has been valuable for you, because Lisa and I started this as let's talk about the conference. Let's talk about the event coming up. Let's really have a good time. We enjoy each other so much. We always end up laughing or crying or some version of that. So we started, so here's stuff in the chat. Yeah. And so what we were thinking is to keep it going. Thank you, Christine. Yeah, Lisa, what do you think? Shall we keep it going? We don't have to end it.
I think, in my opinion, the surprise and delight is your openness to looking at it. And I think that's Bella in the background. Is that Bella?
Yeah, no, it's Cara and Mia.
Oh, Cara Mia's in the background. She wants to be on this.
Yeah.
Here's what I think.
Yes, you can see her face poking out.
Yeah. One of the questions is there's a lot of lives happening already, right? There's a lot of live streaming in our organization. I think, Catherine, what we're bringing to this is really looking at how do you advocate for yourself in work? We're talking about weight bias. We're talking about very personal stuff, way more. Oh, Liza, I've been here 6 and I've cried many times because it was relatable, extremely valuable. Yeah, thank you, Liza. I'm so glad you're here. And Marilee, yes. Oh, I'm so glad. I think I want to keep going, Catherine. I don't think we're done. That's my point, is we thought we'll do it for 6 weeks. Of course, people have access to us in Tribe, right? And they have access on all the lives. But I feel like the conversation that you and I are bringing through this lens is just
I pressed the wrong one. That's because I'm doing it and Gail is doing it. The Tribe membership, I pressed the wrong button. This was what I was trying to do. Christine said it's very valuable.
Oh, yeah, it's funny. So we're trying to let Gail run the show and be in conversation, and Catherine's very good at multitasking, as usual. That's wonderful. So I think what I'm trying to say as we wrap up today is more to follow. It's not bye forever. Oh, Vicki, thank you. Oh, I'm so glad. I'm so glad, Vicki. Yes. So we're going to keep going. I don't know what time of day. I don't know how it's all going to work out. But in my mind, I think we definitely need to do more. There's more to talk about, Catherine.
Mm-hmm.
You agree?
I think we're barely scratching the surface. I think the conversation that I want us to deep dive into, there are many, but one that we started to have is living in a world where anti-fat bias is very implicit in people's consciousness and in the culture. I just think it's time. And it's true. Dove has had all the commercials about body positivity. And one of our community, Allison Jacobs, she is so delightful and so wonderful. And it was wonderful to see her in a Dove commercial recently.
Yeah.
Just last week. And so I think there are inroads, but no one is really talking about it. And I think that's one of the things I want us to continue to have in conversation.
Mm-hmm. Yeah, I think for me, that and asking, advocating for yourself. Oh, Victoria. Oh, Victoria, so glad you're here. We're not done. Okay, got you. I feel you. Um, People are reaching out to me on LinkedIn. Victoria and I have talked. She found us here. We chatted. There's a lot going on in the workplace. Oh, there he's John Chubachek. Sorry.
Chuba.
John Chubak. Keep going. You're from LinkedIn too. See, this is what I'm saying. I'm trying to bring this into LinkedIn. I feel like the workplace needs to understand that as simple as Catherine saying, can I park in the back of the parking lot and can you open the door for me, can help people get what they need and do what they need to do in the workplace too.
Let me just say one other thing. Dr. Chubak, you want to have Lisa on your podcast. This is the Lisa that I recommended to you. So follow up with her and I'm sure she'll say yes.
We're already in conversation, Catherine. That's how important, that's how fast Dr. Chubak works. Yeah, we're already trying to get in conversation. So thank you. Yeah. Okay. So guess what? We're going to keep going. We're going to figure it out. We'll be back and let you know when and how. If this has meant anything to you, which I know it means the world to us, your comments, your participation, sharing these recordings, letting people know about the paper. If you're interested in being in our community as a member, please consider Tribe. It is like nothing ever. And I want to end here and just say that we have a group that meets in Tribe and they do stretching in the morning called Miranda. And this morning we got a WhatsApp saying, we're having a watch party. We don't want to miss it, even though they were in a 3-day conference too. So there's something magical. So, hey, to the watch party in Miranda, to our heart guides, to our community. Catherine, thank you for navigating lipedema with me together and with our community. And what's your final thought as we wrap up today?
Oh, thank you, Lisa. It's just been such a ride. Wow, what a ride is my favorite line. Oh my God. And working with you is so much fun. Together really is better.
Yeah, I agree. I agree. All right. Well, to everyone who commented and was here today, thank you to Kathy and Crystal and John and Liza and Victoria. I'm looking Kristen and Marcia and Vicky and Jody. My goodness, Marilee, Christine. We are in this together. We are navigating lipedema together. Thank you for being here today and more to follow.
And Crystal and Agnieszka, and there's some more.
Yeah, I tried to go all the way up, but there's so many names.
I know,
here.
but there's so many of them. Wilma.
I'm looking.
Oh my God. Actually, Wilma's from the UK. Amazing.
That's wonderful.
Welcome and thank you. And we'll see you. We'll let you know when we're not going to stop. We're going to keep going. We're just going to find the right slot.
We're going to find the right slot. Yes, more to follow. Take good care of yourself. And to circle back from the beginning, what's one thing you can do today to either ask for support, advocate for yourself, or take that one next step to improve your health and support your body and your heart? All right, everyone, make it a great day. Thank you.